Good morning, Mr. Nat King Cole is introduced to Viewpoint, program of personality, politicians, and perspectives. Thinking of politicians, thank God it's over.
Oh, really?
No more terrible commercials telling what a rascal the other guy or the other gal is. Yeah.
In case they're interested, and I know they are vitally interested in how I feel about this.
Yeah,
yes.
well, that's right. They're hanging on it.
The next time we have an election, if those participating could please say, I see this as a real problem for us, and I think we should do this to solve it. That would be so much more helpful than these millions and millions of dollars worth of commercials that are of no use to the electorate. They tell me nothing about where this person stands.
That's the elephant in the room. This is media. This is media. But, seriously, you're exactly right, and I'm sure James Ash would agree. There ought to be a limit. That's not going to happen in my lifetime. Speaking of lifetime.
Yes.
Found something here. It says, what happens to your body as you age?
Bad things.
Well, a lot of things. Well, when you get so old, so do your bowels, and you get intercontinental. All right, that's
I was just looking at your paper,
that's
and
my silliness for the day.
I thought this one was just a hoot. What are steroids? Now, you're in the public health field, sir.
Yes.
The steroids are things for keeping carpets still on the stairs. Probably so. Well, yesterday, I was election judging.
Yes, I want to talk to you
at
about
the Christian church, and we had over 450 people at our precinct. I think it was just a miracle, the turnout. We had no downtime at all. It was a 15-hour day, and it was full time, the whole time. Several times there were people lined up at their precinct place to get their ballot. Several times there were people lined up waiting for one of the election booths to open so that they could vote. It was just absolutely a miracle. I was so grateful to see the turnout.
Well, I was a little upset.
Oh, yeah?
Wouldn't let me go twice.
Oh.
Anyway, of a serious note, that would be my kudo for this morning. Don, we've always tried to start this Viewpoint, we try to each Wednesday, with a kudo of some organization or some individual. Anyway, kind of turn on a positive note. And I think the fact that all the election workers, Judith, you report at, 5 o'clock in the morning?
Yeah.
At the polls. And in your case, you got home a little after 8, which was remarkable thanks to computers. It used to be a lot later than that.
Oh, gosh.
But you put in a long day, and I'm not sure that you get all that well paid for it. So kudos to all of the election judges, and certainly to Sally Turner and her staff. They've done a remarkable job. Each and every election they just do. No wonder Sally's been voted the best clerk of the 102 counties.
Yeah. Really.
So our kudos to that. Did you have any unusual incidents or anything at the polling?
Nope, just same old. But it was just, to me, it was just so amazing to see that kind of turnout. And there were people who'd ask a question, and by the question, you'd kind of guess that maybe they hadn't voted for a while. So there were people who came out who hadn't.
Well, that's a good thing.
And we had a stack of people who'd already voted during the opportunities at the courthouse.
Well, that's one of my soapboxes about people and the not voting and so forth. And, it's the one way we have to express ourselves, however small it may be, and we turn out on the losing end of how we express it, but at least we had a chance to say what I think about such and such. So, anyway, it's over. In the can. I think there will be some people pretty happy. There might be some people that may be a little dour today.
Oh, yeah.
Well, remember, folks, we were dour for a long time.
Are you passing your dower around?
Okay.
All righty.
Let's get down to some serious business. We have a gentleman with us this morning who performs a great service to the taxpayers of Logan County, speaking of voters and so forth. So why don't you introduce Mr. Cavi?
Yeah, I'd like to. Don Cavi is the administrator of the Logan County Department of Public Health. Speaking of busy places, and especially
Absolutely.
right now, Don, my gosh, it's flu shot season, and I'm sure the people are coming in. You want to give us the hours and days that the shots are available to you?
Sure.
Say, by the way, that's a really excuse me for jumping in there, but that's a really wonderful service to the county, and it's so well run.
Oh, yeah.
You don't wait around in there. You go in and you fill out the necessary forms, and in a few minutes you're in there and you're stuck and you're out of there.
Oh, I have long been an admirer of everything about the Logan County Department of
Yeah,
Public Health. In
you
my
betcha.
misspent youth, I was on that board for quite some time. And
boy, did she
enjoyed every
misspend her
minute.
youth too.
And enjoyed it immensely.
Yeah.
They provide, this is, like Bill says, such a wonderful service, but there are so many services that you provide. What are your hours and days for flu shots?
Yeah, well, first, thank you for the kind words. Really appreciate that.
Well, we mean, we don't mince around. If we don't like it, we tell you.
Yeah, well, I really appreciate that. And it makes my job easier. I just stepped in to this position. This is actually my second full month on the job. And, I've been here 5 years, and it was a great place when I first came in, and I look forward to continuing to move it in a positive direction. But, the staff there is just tremendous. Everything down from our office support to our nurses and our dentists, they all do wonderful work. Our hours are 7:30 to 4:30, and that's Monday through Friday. And we do take flu shots and walk-in flu shots, which is great. It's convenient for people. They don't have to schedule appointments. So, but yeah,
And
thank
it's
you.
not certain days, is it, Don? It's every day, right?
Exactly,
Yeah.
except for holidays, of course.
Well, Christmas you won't be there.
No, we won't be there for Christmas.
I can
Well,
understand.
And we are closed Veterans Day, by the way.
Yeah.
Oh, yeah, I'd like to think so.
Yes.
Pneumonia shots. We've also had those there.
Yes.
Now, help me out. Is a pneumonia shot a one-time shot?
I really,
I forgot.
I don't know. I do
think
know.
I'm okay now at this my age, but
Yeah, I could tell you about flu shots probably more than I can pneumonia shots. I do know some flu shots. It may be recommended, especially for children, that maybe they get 2 doses of flu shots. Again, it's whatever is recommended by the clinician. But with regard to the pneumonia shot, I would have to the thing you need to do is you can call the health department anytime, and the nurses can answer that question for you.
523-735-2317.
Yes, our number is 217-735-2317.
Right.
Absolutely.
Well, you just shocked me.
Why?
You're wearing a pretty face.
Well, that's why I can't remember what I had for breakfast. My head is full of telephone numbers.
Don, I notice you have your master's degree. What is LEHP, sir?
That is a licensed environmental health practitioner. And when I got my start in public health in the environmental health arena, and when I became a director of environmental health, that's one of the requirements of the state is that each health department has to have somebody who's licensed. So that's how I have that. And before I took the administrator role here, I was the environmental health director for the previous 5 years. So
If we can get back to the flu shots, they're recommended for people across the board, actually, aren't they?
the CDC recommends that anybody over 6 months of age should get a seasonal flu shot. Yes, absolutely.
And for children, there is available a shot that isn't an inoculation. It's a nose spray.
There is a mist shot, yes, and that is available for children, and I think it's for people up to 18, if I'm not mistaken. But yes, there is that option to have either the injection or the vaccination.
I'd like
which
to
is
urge,
convenient.
listeners out there, if this is an opportunity to talk with the gentleman who's in charge of your Logan County Health Department, and you might have some questions, Mr. Don, and 648-5510 would be the number to call. Don't hesitate, because he's here to help you.
Absolutely. We're we've been real busy right now. We've had a lot of people come in for the flu shots, which is wonderful, because the thing about vaccinating yourself is you're not only protecting yourself, but you're protecting the community. And that's why we always recommend that everybody come and get their flu shot. This is the busy time of year through October and all the way into May. So the wintertime is the busy season for the flu, primarily because the air is cold and dry during the winter months, and the flu virus is more stable. And that's why, the flu is so active this time of year. So even in the spring, it's still flu season.
We always call things the flu. Must have had the flu. Had the punies yesterday. I think I had the flu.
Yes.
But that isn't the case. Flu is a real thing. It's more than just a run to regurgitate. It's a killer.
Yeah, as a matter of fact, thousands of people each year die from the flu. I was reading, and I believe it was the CDC, they said on average, children under age 5, there's at least, on average, about 20,000 deaths per year.
Really?
Due to the flu, absolutely. And so it's I want to say either deaths or hospitalizations, but regardless of that, it's a pretty severe, situation.
Right.
I do have
with
they're hospitalized. Excuse me, I got to change. I said deaths, but they're actually hospitalized. So 20,000 kids a year average that are hospitalized due to the flu. Thousands of deaths. It's pretty serious. You have to take it. You can't take flu with a grain of salt, and that's why flu vaccinations are so important.
What is this bug that's affecting youngsters, like in daycares, and it's a respiratory thing, and it's an acronym for whatever?
Well, I'm familiar with the enterovirus, which has been more common with the younger kids, and I know that was a concern. We're not hearing as much about that now, but anytime parents have a child that, or even themselves, anybody who exhibits flu-like symptoms, it's always a good idea. Call your doctor. Find out if they want to see you in their office.
Your department seems to serve, at least on observation, when we've been over there. Happily, it's run just go and get our shots. That's the only time we have to come. But I've noticed what seemed to me a large number of young mothers with their infants in there. And you must serve an awful lot of young mothers with their babies on a daily basis there.
We do. And the nice thing about our health department is, we do have a lot of young mothers, especially in our WIC program. And
so what is that program, sir?
Women, infants, children.
Women, infants, and children, right.
Okay.
And we follow up with young women. They have their children, make sure the kids are eating right, make sure that if mom's pregnant, that she's getting the right nutrition. We also support and we work with local partners with breastfeeding program to encourage that. But if these people come in for WIC services, right there, it's a one-stop shop. If they need to get their vaccinations, they can get vaccinated. So that's the benefit of having multiple services like that for prevention, is that we can provide multiple services at one visit.
For a while, we were hearing so much about. Obviously, it would be young mothers, because us old mothers don't have any little children anymore. About them not wanting.
There's a reason for that too.
God is smart.
God had it right there.
Yeah, it was a good plan to give them to young people. That's for sure. But there was a move among many not to have their children inoculated, and they were saying that there was a real danger, real and present danger of some of these diseases that we thought of as eradicated coming back.
Yeah.
In fact, when I was working at the hospital, they offered us all the mumps or shot. Is that it? The
MMR,
measles
is it?
shot?
Measles, mumps, rubella?
Yeah, and I thought, I really should do that, because what if I had occasion to escort a new mother and baby out to go home, and I'd been exposed to this at the grocery store or at church or something, you could pass it on. So really, I'm such a firm believer in inoculations. I hope
Absolutely.
that reaction on the part of people has changed a bit.
Yeah, I do know there was a push by some that there was a concern that vaccination would cause, the whole autism thing. And bottom line is, I haven't seen any research or studies that have really proven that.
Well, you can pretty much say anything you want. It doesn't make it true.
Absolutely.
Like every other-
Vaccination is really the best way to prevent. And I don't want to. And another way people can prevent spreading disease is simple hand washing. Do it frequently. Avoid contacting your eyes, your nose, and your mouth, and wash your hands frequently. Because that, the virus, if it's on a surface and you touch the surface, you start rubbing your face or your eyes, you can transmit that virus and you become ill, so
That's in fact the number one germ fighter. Just simple hand washing. But it has to be soap and warm water, and it has to be getting your nails and your cuticles, and you can't just one pass under the cold water isn't going to make it.
Right. You want to use warm water as tolerable as possible, but you want to at least rub your hands with soapy water for at least 20 seconds. Get between the fingers and like you said, in the cracks and crevices, and use a clean towel to dry your hands. If you've got a dirty towel that's been sitting around for a month and you're drying your hands with it, well, you're just re-dirtying your hands.
I must tell Gene that.
Yeah.
Well, that'll make you popular.
Yeah. If you go to restaurants, because we do a lot of inspections there, they use paper towels to dry their hands. And I get in the habit of using paper towels at home. Needless to say, we go through rolls right and left. And, but it does help.
But that is a good plan.
Absolutely.
Tell me about your budgetary problems. All organizations today, particularly at the governmental level, budget restraints and constraints. Got to be tough to run an office, and you've got a great. By the way, you do have a great staff there.
Thank you.
The folks that you have on board that ship all are a good crew.
Absolutely, thank you.
And they meet the public so well. They just have a way about it. But I know that you have budget problems. You can't have that office without having. How are you getting along there? And how is your financing?
We're hanging in there. We're doing all right. You're right. Just like any government agency, we have to try to cut corners wherever we can. But we are looking at ways to try to increase revenue. I've got a new nursing director coming on board here soon. We're going to work together, and I'd like to see ways in which we can outreach more to the community and maybe provide additional income opportunities for us to help support what we're doing. We're obviously not in the profit business, but we're also looking at something that's really exciting that I and my predecessor started it, and I'm in the process of getting this ramped up with our staff, is we're going to have the capability starting around the beginning of the year to electronically bill private insurance companies. So if anybody has a private insurance company and want to come in and get their vaccination, give us the card, we'll run it through, and we're good to go. So I think that's going to allow some opportunities for us to try to capture more, capture some more dollars to support our cause. And I think a lot more doctors' offices are, some of them are tending to get away from the vaccines. There's a lot of loopholes, especially with the state programs and the vaccine for children programs, and we complement the medical community, so we're a great place to get your vaccines, and this is just going to make it easier and more convenient for people.
I want to talk to you about the source of your money, but first we have to talk about the source of the money for this station. We have what we call commercials, and we need that source of income to make these programs work. Go ahead, Mr. Ash. Right. back to here. I have a story here. What is this program? Viewpoint? Yeah. And your name is? Judith K. Busby.
How soon do you have to know?
How soon do I have to know? Well, serious note. Judy and I try to bring in various guests from all around the area to maybe impart a little extra knowledge about what's going on in the community. And we appreciate the appearance of Mr. Don Cavi this morning. Don's our administrator over to the Public Health Department out there on 3rd Street. New into the job almost, a couple of 3 months now, Don?
Yeah. Getting there.
Yeah. I complimented you a while ago on your staff, and I meant that most sincerely.
Thank you.
Way back years, how long ago has Walter Cronkite been gone? Uncle Walter,
Oh,
he'd been
God.
gone a long time. Well, he was a little bit prejudicial about America's healthcare system. At one point in time, he said that it's neither healthy, caring, and it's not a system. Well, those things can't be said about the way Don is running and his associates are running the Logan County Department of Public Health out there on 3rd Street. They are caring. They help us a lot with our personal and individual health matters, and they run a pretty good system.
You bet.
So
Thank you.
Don, I wanted to ask you, you've got to pay a salary, you've got overhead, got a lot of expenses, so you've got to have some income. How do you get your support?
Well, a lot of it is a lot of our funding comes from fees and through grants, and we rely heavily on that. And that's you bring up the funding, and that's something we need to look at too. Is what other grants are out there, and any opportunity we see to grab some grant dollars to run some additional programs. We're gonna keep our eyes peeled out for. We certainly rely on the support of the community. And I'm appreciative of the county board and to everybody for supporting us, even in the hard times. But you got to think, without a health department, what would happen? Just about every county in the state of Illinois has their own health department. And why is that? Because public health is so important. And but we do have to find ways to be self-sufficient and ways to think. We have to think outside the box a little bit, and that's the limited funding does force you to think outside the box. What other opportunities are out there that we can reach out to the community, and the more we can reach out to the community, the more we could help support ourselves.
Well, I just sat there the other day with Jean and I were waiting to get our shots, and I see these young mothers, some unfortunately much too young, without your place for them to go, they're up the creek.
Yeah, and we do provide valuable services to those clients. So absolutely, and yeah, you're right. Where else are they going to go? And the health department we're right there, readily available for them. Absolutely.
And that prenatal care
And they're
is so
met with the same compassion as Mr. and Mrs. Joe Smith who walk in.
Yeah. Yeah.
They're treated equally, just like as they well should be.
Yeah. And we work very strongly with local partners, with the hospital and other local agencies and doctors' offices. And if there's a child with a high risk, a hospital where a woman with a high-risk child is born, maybe the child has Down syndrome. The hospital notifies us. We work with the hospital, and we do home visits, and we work with that child for the first couple of years, and do developmental screenings and those types of things. And so, the nice thing about what our agency does is not only just for the community that we can provide these services, but we can work with other medical providers, and that's really the key for public health. It's how it's going to work, is we're all going to have to, partnerships, we're going to have to develop and continue to develop partnerships. Fortunately, we do have good partners in the community, and we can always continue to make those relationships even stronger. So,
in talking about public health, I think it's kind of on most people's minds at this time, because we've talked so much about the health of the poor public in Africa that has been stricken so far and wide with this Ebola. So then on the news we hear right along about preparations here and restrictions here and ways that the CDC, etc., have come up with in order to keep this epidemic from spreading here in the States. What do you hear from the CDC and the state government, for instance, and what are their policies by way of preventing this?
Okay. Yeah, the CDC, the Centers for Disease Control, one of their primary functions is disease surveillance, to make sure that our country is safe and to make sure that the spread of disease from other countries is eradicated, and they're kind of the eyes and ears of our country. And we've done a lot of work. We've been we've done a lot of corresponding with CDC and with the state health department, and they're basically keeping an eye on the situation. Now, I think what people have to remember about Ebola is that there's no reason to panic. Let's face it. The people. This is an issue. In Guinea, Liberia, and Sierra Leone, I should say, where those are where the issues are, and that's where it's originating from. The CDC is working hard to protect us. If anybody's flying in from any of those countries, they've got an intensive screening program. There's 5 airports that restrictions are held to where people from these countries can fly into, and I believe O'Hare is one of them.
Yeah, I guess.
Where they do intensive screening and they determine, they'll ask questions. Have you been with somebody who has Ebola? Have you been in contact with them? If so, were you wearing proper protective equipment? And they'll screen them to determine, are they a high or are they a low risk? And obviously, if the person's at high risk, then they're going to have to be either isolated or quarantined. And so that's part of the protocol. Now, if somebody is at low risk, and if they reside in Logan County, then there's going to be a lot of follow-up and coordination between the CDC, the state, and us, and we're going to have to make sure that this person is monitored and that they're not going to be a threat to anybody in the community. The Ebola virus you're not considered a threat to spread it if you don't exhibit the symptoms. Okay, so you're not contagious if you don't exhibit the symptoms. The symptoms of Ebola there's what we call an incubation period of 2 to 21 days, meaning if I come in contact with the virus, then it could take up to 21 days before I start showing the symptoms of Ebola. And that's at the point where somebody becomes contagious. So, there's an intensive monitoring program. Fortunately, we don't have a lot of people flying in from those countries, but that's something, that we are working on. We're working with the local partners. We're working with local responders on developing a plan. If, in fact, somebody that has been in one of those countries flies over here and lives in Logan County, we're going to make sure that we're going to assess the situation and make sure that we're following it properly, so nobody within the area is going to be jeopardized in any way. So,
Don,
yes,
accepting money, funding, which of course you can't really accept, but that being out of the picture, is there any one big problem that you have there on 3rd Street that you would like to see solved?
Any big problems on 3rd Street you'd really like to see solved? I think you kind of hit it, as the whole budget and the challenges with the budget. I think that's probably my greatest challenge, is how we can be leaner and meaner. I think as far as our services go, I think we do an outstanding job. I always think there's room for improvement. You can never be complacent about anything. You always have to look to even better yourself. We've got a wonderful dental clinic. We've got our home health program has won national awards. We've got an outstanding staff. Absolutely. Our environmental program, we're on top of our inspections and so I think my biggest challenge is probably getting the word out to people that, hey, we offer these services, and we've heard from people in the past that, we didn't know you had a dental clinic there, or we didn't know you did this or that.
Or environmental services. May we touch on that just a minute?
Absolutely.
And under what blanket are those services performed? So take it from there. I'm not sure just where I want to go with that. I'm anxious to know how we are served in that department.
Okay, every year we get a public health grant from the state. We're a certified health department, meaning we get, we're recognized by the state. We get grant dollars from the state, albeit it's not a lot of money. I think everyone would like to get more money, but that money comes to us, and we have got to offer 4 programs: a communicable disease program, such as our clinic, a potable water safety program for private wells, food sanitation, and proper sewage disposal. So the core programs in the environmental program that we have is the food safety sanitation for sewage and proper drinking water. So for instance, we handle the county area. So people that are on private well or a private septic system, we have to work with the contractors. We issue them the permits. We make sure that everything's being constructed in accordance with what the state code requires. And then we go out, we actually inspect the systems. We will take water samples of new wells. We'll provide consultation to homeowners and to contractors on how it has to be done to be in compliance with regulations. And then we also license all the food establishments in the county, and we have to go out. It can be anywhere from 1 or 2, maybe even 3 times, even more per year, depending on the need to do our food inspections. And again, we do a lot of consulting, a lot of education. The food handlers statewide. Yeah, absolutely. And I tell people, we regulate, but I like to think of us first and foremost as educators. And because if you don't teach people how to do it right, you're going to have problems. So let's get to the root source, and let's tell them this is how food has to be properly served. We have programs in the county. The state requires food handlers that they have to either have a certificate, a food sanitation certificate, or if they have to go through training, and we offer those to the local food service community. So hopefully that answers your question. But we have other outlying programs that we do in environmental health. Any nuisance complaints that we have in the county, we do have a county nuisance ordinance. If somebody has weeds in their yard and unkept property, we'll go out and we'll do those inspections. And again, it has to be out in the county or in unincorporated areas. We also do in the summertime, and I've had the last few years an intern come in and work this program. We get state dollars to run a West Nile virus surveillance program. I had a gentleman from University of Illinois Springfield come out, did a great job for us. He went out and located potential mosquito breeding sites throughout the county, covered pretty much all the county, set traps, collected mosquitoes, and we have a kit that he uses to test to see if we have West Nile virus in the area. And fortunately this year we did not have any positives. Last year we had one mosquito pool that was positive. And then we also collect any birds out in the community and send those to the lab for testing. In the last couple of years, we've actually had a couple positive birds show up, and then we notify the community that we've either had a positive mosquito pool in this area, or there's been a bird that tested positive. So reminding people, beware. Wear your mosquito repellents, your long sleeve clothing, and try to remove any standing water on your property. So it's not only surveillance, but it's education too. So we do a lot of that, and then consulting. We get a lot of calls from people about things we really can't regulate. For instance, mold is one of those real tough issues that's hard to deal with. But we get a lot of calls regarding mold, and we'll try to educate people on what they need to know about it. Unfortunately, we don't have the facilities or the equipment to test for mold. But if we can help guide people in the right direction, we'll try to do that.
What kind of things do you discuss with a person who calls because they think that they have a mold problem?
Well, we'll ask them first of all what the situation at their house. We'll ask them, have you talked to the landlord if they are renting a house? If they live in the city, sometimes we'll refer them to talk to the city inspector, because it could be a structural issue that's causing the moisture in the house. And if the city can address that, because it is a structural issue, then perhaps they can do something about that. Otherwise, we refer them to maybe some testing agencies or where they can go to get their mold tested. It's a real tough thing, because it's one of those situations you want to do more for people, but we can only provide education. And the EPA website and CDC, they all have information on mold, and we'll direct people to those websites also. So, some things our hands are tied on, but we'll do what we can. If we can't help anybody with a certain issue, we're going to try to direct them in the right direction. I don't believe in just shutting somebody off, say, no, sorry, can't help you, see you later. It's more or less, we don't really have a remedy for you, but here's somebody maybe you can talk to. So, we try to help in that
Which
respect.
is a good point in and of itself. Now, do you report directly to the Illinois Department of Public Health? What is the next level in this echelon of organizations? Is that how you, who administers your office, sir?
Well, we have, excuse me,
Who's minding the store?
we have a board of health, which consists of several individuals, some physicians, dentists,
At the local level.
and right, chiropractor, nurses, and just the community, and they basically govern what we do. And so if I have questions, a lot of times I will seek advice from them. But they're basically our governing body here in Logan County. However, with regards to some of our regulations, like for instance, I brought up before the water wells and the food inspections and those types of things. We're enforcing state regulations. If we ever have any questions or issues, sometimes we'll go to the state level, and if we need assistance, we'll seek assistance from the state level.
I guess what I was getting to is the bureaucracy involved if you have questions like that, and whether or not at the upper level, at the state level, you'll get some immediate response to your inquiries, or whether sometimes it sits on somebody's desk and because it's a bureaucracy.
If it's just general information we need, then the state is real quick to provide us with the details, everything we need to help us do our job. That's part of being a grantee from the state, is that they're there to support us if we need it. The hardest things to get things done on are if it's a health issue that's going to require major funding and nobody has the money to spend for it, and I don't have any specific examples, but that's where it gets real tough. If we have an issue that's maybe it's an EPA issue and they should be involved in somewhere, but we need to get something corrected, but it's going to cost millions of dollars. Well, that there's always the hurdle there. But but I can, as far as the state and the EPA and all the other agencies we work with, they've been great as far as providing us with information we need and supporting us.
You feel excuse me, go ahead, please.
I've heard people grumble about the health department, especially like churches when they have a bake sale and they say, well, now they won't let Mary bring her coconut cream pie. And
Right.
If I've heard that, I know you must have heard it 7 million times.
Yeah.
What do you say to the people? How do you educate them?
Sure. The last thing we ever want to regulate is bake sale. Especially, bake sales are allowable if they're, done infrequently. In other words, somebody's not doing it for private venture and they're not out every week selling food. But fundraisers, as long as they're done on a minimal basis, but provided that the food that is provided is non-potentially hazardous. And it's just a safeguard to protect the public, And so I think it's fair to say, that we do allow it and we do allow flexibility. But when people are starting to sell foods at bake sales that require refrigeration, and if it's not refrigerated, that could be a major concern. So I think we do a really good job of working with people. But I encourage people, rather than be upset with us, to call us ahead of time before you do your event, so you know exactly what the state requirement is. We're not trying to be the bad guy, but we're just trying to enforce the law as the state tells us how we have to do it.
You're not being punitive. That's not your job.
It's not a personal thing against anybody.
You're not against Mary and you don't hate her pie, right?
Absolutely.
Well, now what about, speaking of Mary Ann's, it's the middle of July and August, and it's hotter than the hubs. And so puts a lemonade stand out on the corner. You don't see that around here very much. But
You're going to put me on the spot on this
and
one,
sure
aren't you?
enough, well, that's our job. Sure enough, Big Brother comes along and says, "Yeah, you can't do that, Marianne. That's endangering the health."
Yeah, I think you got to. There's a fine line. You really have to be
Common sense got to kick in somewhere, Don.
Yeah, I mean, there's a
Although
fine
I
line,
find it
and
worthy of that.
I just don't like to be, lemonade. Fortunately, lemonade it's not one of those products that's
stable.
gonna, it's not like you're selling cream pies and, dairy products and meat, and it is pretty stable. So I mean, some things you just got to use common sense on.
That's such a beautiful word, and I think that there's a woeful lack of it sometimes, and we of the public sometimes blame government for the woeful lack of common sense. And really, so many things should be approached that way.
Right. Yeah, and
I'm glad you feel that way.
I'm very much. I think you have to approach things with common sense. Everything. Life isn't all black and white, but we have to look at it though. Here's the code. These are what are the requirements, and we still have to be operating within that boundary. And I'm talking in terms of my environmental voice is speaking here.
Yes.
But if there's a little leeway here and there, as long as we have a way to keep an eye on it, and that we know that the food handler, I'll use that as an example, is taking responsibility. But as long as we're within those parameters, we're within the guidelines or the regulations, I should say.
If you have anything you'd like to close with, Don, before the clock is going to run out on us. So you go right ahead, please.
Thanks for giving me the floor. I just real quick.
Well, it's very important.
We do have we're giving out free radon kits to the health department, and while supplies last. So I encourage anybody to come in, pick up your radon kit. So please, radon is the second leading killer of cause of lung cancer, second to smokers.
No, really,
and
I didn't know
absolutely.
that.
So we do encourage people to get your home tested. As far as Ebola goes, I believe the state now has there's a 1-800 hotline, and if I can find it, great, and if I can't, unfortunately, I won't have it. But there is let's see here. I don't know if I have it with me. If I find it, I'll let you know. But the other thing is we do have a newsletter coming out in December, so people should be watching out for the newsletter. We've got a lot of great information, and again, another reminder that for private services, private insurance will be able to bill directly for those services, and we anticipate that will be around the beginning of the year. And I would say this, I don't have the numbers not in front of me right now, but if anybody wants more information on Ebola, go to the cdc.gov website, because they've got a lot of great information on there, and there are numbers. The Illinois Department of Public Health also, their website has a lot of information on the front page, and I believe that's where you can get the state Ebola hotline number. It's a 1-800 number, and I apologize that I don't have it in front of me. I had it highlighted somewhere, but I can't locate that. But Illinois Department of Public Health.
Well, we think we're pretty insulated here, provincially, the way we.
Yeah.
So I don't think that's a high on anybody's radar screen here.
Right. And the
awareness is important.
Right, and Ebola, it's contracted through its transfer of body fluids, which if it was something where you'd sneeze or cough and somebody near you can get sick, that's even more cause for alarm. But if it's just body fluids, you'd have to come in physical contact with that person. Mm-hmm. I was reading up, and the coughing and sneezing typically wouldn't spread it.
Right.
I mean, if it's a large enough droplet, who's to say it wouldn't? But you're right, Bill. I mean, that is, it's not like we need to panic here. And again, the CDC and the state and the local health departments and the local emergency planners, we're all working together on a plan to keep people safe.
Well, they have a screening out there at Martin International Field at Burtonview for international passengers coming in. So, Don Cavi, administrator of our Logan County Public Health Department, we appreciate you taking your time to share your responsibilities and duties with us. You and your cohorts out there really perform a great service for the citizens of Logan County, and we thank you for that. We always try to close with some sort of a quotation. I looked up some public health quotations and so forth. And about the only thing I find is it would apply to hypochondriacs. Voltaire, that would be Horace Voltaire, said, the art of medicine consisteth of amusing the patient while nature cures the disease. Something to be said for that. Thank you, Don Cavi.
Well, thank you for having me on your show, and I really do appreciate it. It's been a pleasure.
Thank you.
Thank you.